office, who has been so helpful to me, not just on the student loan issue, but on all educational issues, affordability of education, the quality of education, the opportunity for everyone to have the great dream of America. She's been a very, very valuable asset to our staff, and I will certainly miss her in my Senate office, and I wish her only the best. And with that, Mr. President, I would yield the floor.
Quorum.
Yes, the absence of quorum.
Clerk, call the roll.
Mr. Alexander. Ms. Ayotte.
Senator from South Dakota.
I ask unanimous consent the quorum call be dispensed with.
Without objection.
Mr. President, last week on July 2nd, the Tuesday before July 4th, Independence Day on Thursday, the administration made an announcement that they were going to delay implementation of a key component of the Obamacare law. I think that came as a surprise to a lot of people because the expectation has been all along that come January of this next year that many of the provisions in that law were going to go into effect. And tomorrow, majority about the delay of the employer mandate, the administration unilaterally acted and failed to work with Congress on what is a very significant decision. This action finally acknowledges some of the many burdens that this law will place on job creators. And I believe the rest of this law should be permanently delayed for all Americans in order to avoid significant economic harm to American families. In response to questions about the administration's decision, the President's senior advisor, Valerie Jarrett, said, and I quote, "We are listening," end quote, while referring to the concerns of the business community over the onerous employer mandate that will result in fewer jobs and employees working fewer hours. We've been listening as well, and as more employers have attempted to understand the burdensome requirements in the President's health care law, the louder their outrage has become. In particular, small to medium-sized businesses are simply drowning in their efforts to understand all the regulations. We're also listening to the views of the American people. A recent Gallup poll from this week showed that a majority of Americans still disapprove of the health care law. The survey showed that 55% of respondents disapprove of Obamacare. A Gallup survey last month revealed that for every one person who believes that they will be better off under Obamacare, 2 believe they will be worse off. Opposition to the health care law is growing, and it will continue to grow as more Americans realize that the law is built upon broken promises and will result in higher health care costs and more taxes. Under the individual mandate, the IRS, which is still under multiple investigations for unfairly targeting conservative groups, will play a central role in the implementation of the health care law in our country. Last fall, the Congressional Budget Office estimated that nearly 6 million Americans, primarily in the middle class, will have to pay a tax under the individual mandate, which is 2 million more than was initially estimated. When the Affordable Care Act is fully implemented, the average individual mandate tax will be nearly $1,200, which clearly contradicts the President's previous statement that the individual mandate is, quote, absolutely not a tax increase, end quote. Further, families are facing significant increases in premiums. The Wall Street Journal recently published an analysis of premiums and concluded that under the health care law, some Americans will see their premiums double or even triple, which is the opposite of the promise that was made by the President that premiums would go down by $2,500 for American families. Given the widely held belief by the American people that the Affordable Care Act will not fulfill its promises, it will result in higher costs for American families, I believe this law should be permanently delayed. This law is unworkable, harmful to the economy and to American families, and actions to delay the employer mandate is an acknowledgement of this very fact. Public opinion about the Affordable Care Act has been consistently low. Perhaps Americans don't like it because it's affecting their jobs. 4 in 10 small business owners say they've held back on hiring, and 1 in 5 owners say they have let employees go due to the health care costs associated with the Affordable Care Act. As implementation of the law continues, the number of small business owners who take these steps could increase. Employers are also cutting back on hours in anticipation of the mandate. Even though enforcement of the employer mandate may be delayed, employers still know this is coming down the pike and will continue to make adjustments to their workforce in anticipation of the new mandates. A new mandate will also be imposed on individual Americans. On January 1st, Americans will be forced by their government to buy a product, health insurance, for the first time ever. This mandate will be enforced by tax penalties administered through the Internal Revenue Service. The Obama administration has requested over $400 million in funding and nearly 2,000 bureaucrats for the IRS to implement the individual mandate and 46 other statutory provisions. The blizzard of Obamacare rules and regulations continues. Regulators have now written over 20,000 pages of Obamacare-related rules and notices in the Federal Register. And just this last week, another 606 pages of new regulations were released that were designed to assist in implementing this massive law. It's no wonder the public outcry from employers was so loudly opposed to the employer mandate. American families are also struggling to understand how this complex, burdensome law will affect them. And it is critical that the President and his administration listen to the American people and permanently delay this law. And I would add, Madam President, if you look at the impact on the economy, not only is this about higher premiums for middle-class families in this country, not only is it about higher taxes that are going to be imposed upon medical device manufacturers, on health insurance plans, pharmaceutical companies, all of which, by the way, will be passed on to individual consumers. It's also about the impact this will have on jobs in the economy. If you look at just the numbers that came out last week and what they said about the impact of policies coming out of Washington, D.C., and the impact that they're having on jobs in this country, the number of people working part-time for economic reasons, sometimes referred to as involuntary part-time workers, increased by 322,000 people to 8.2 million total people in the month of June. These are people who are working part-time because their hours have been cut back or because they were unable to find a full-time job. The real unemployment rate, or what we call the U6 rate, is 14.3% for June of 2013, which is an increase of a half percentage point over the previous month. That's the total percentage of unemployed and underemployed workers, making the real number of unemployed Americans in this country 22.6 million people. These are people who are unemployed, want work, but have stopped searching for a job or are working part-time simply because they can't find full-time employment. And I would add, Madam President, that when policies coming out of Washington that are, I think, very exemplified by the Obamacare mandates are imposed on the American economy, it makes it harder for job creators and employers in this country to create the jobs that are necessary to affect these numbers in a positive way, to get Americans back to work in a full-time way, and back to work in a way where they are actually increasing their take-home pay rather than having it decreased by higher costs for everything that they have to spend their incomes on, including the cost of health insurance coverage. You know, we've been saying for a long time, and there are studies after study that come out that talk about how the health care law is going to cause health insurance premiums to rise. And there's been a lot of people who've gotten up here in the Senate, others in the administration, in an attempt to defend the Obamacare law, who have said, no, that's not going to be the case. This is actually going to drive premiums down. And we continue to hear that as more and more evidence comes in, not only just studies that are being done out there, but real-life examples of the impact that this law is having on insurance premiums. In fact, there are some actuarial studies that have estimated premiums in various states around the country and what the impact on premiums would be. State of Colorado in the individual market, the estimate is by the actuaries that the insurance premium rates are going to go up by 19%. State of Indiana by 95% in the individual market, by 10% in the small group market. State of Maine, estimates are that the individual market premiums are going to go up by 40%, 9% in the small group market. State of Minnesota, in the individual market, 42% increase in premiums in the individual market and 20% in the small group market. State of Wisconsin, 30%, Madam President, in the individual market increase. The state of Ohio, last month, Department of Insurance announced that the average individual market health insurance premium in 2014 will cost 88% more. According to Ohio insurance regulators, the department's initial analysis of the proposed rates show consumers will have fewer choices and pay much higher premiums for the health insurance starting in the year 2014. Well, it shouldn't be any big surprise, Madam President, when you look at the requirements in the new health care law. The new health care law said that there are you have to have a certain kind of coverage. You can't continue to offer coverages that are available to people who might want to have different choices about what types of things they want covered, what they want their co-pays or the deductibles to be. Basically said if you're going to offer a plan, you have to offer this plan. It's a government-approved plan. and it has to have these sorts of coverages and these sorts of things and these bells and whistles in it. It also said that you can get insurance after you get sick. It's called guarantee issue. No longer do you have to, is there any requirement that you go out and get insurance to protect yourself and prevent yourself from having to be in that situation when illness strikes. Now, if you get something, you get sick, then you go out and buy insurance. It also requires community rating, which changes the way in which health care costs are distributed across the range of people that are covered by health care premiums in this country, and making it more expensive for younger people to get their health insurance coverage. And that's why you're seeing these steep increases in the individual market. And so, Madam President, when you look at all the, Madam President, I would ask unanimous consent to be able to continue for a couple of minutes.
2 minutes? Good.
So when you look at all the mandates, the new requirements in the legislation, the new taxes in the legislation, when you look at all the states that are trying to deal with this and cope with this, all the small businesses, and the small businesses obviously weighed in heavily, and that's why, as I mentioned earlier, the White House said, look, we're listening, we got the message, so they waived this, they delayed this at least for a year for the sort of small businesses under the employer mandate. All we're simply saying is, look, there are lots of problems associated with this law. This was a bad law. It is based upon broken promises. It promised lower premiums. We're seeing higher premiums. It includes higher taxes. You're going to see effects all across the economy when it comes to jobs as people cut back and start forcing people into part-time jobs so they're not hit with the employer mandates under this legislation. So it affects jobs, it affects the economy. We've got a sluggish economic growth rate. It's now been adjusted down to 1.8% in the last quarter. We continue to sort of muddle along, and one of the reasons for that, Madam President, is because we here in Washington, D.C. continue to pile more and more costs on employers trying to do business in this country. And until we understand that if we're going to create jobs and grow the economy in this country, we've got to make it less difficult and less expensive for employers and job creators to create jobs. We're going to continue to see this trend in the future. And so I would simply say that to my colleagues here in the Senate and to the administration, that if you're going to delay implementation of the employer mandate for a year, let's delay the individual mandate as well. And let's not just do it for a year. Let's permanently delay this. Let's start over. Let's do this the right way, and in a way that actually reduces premiums and health care costs for people in this country, that makes it less expensive and less difficult for small businesses to create jobs and to grow the economy, and to get Americans back to work in good jobs that pay well, that increase the take-home pay, so that they can provide in a better way for their families. Madam President, with that, I yield the floor.
Madam President.
Senator from West Virginia.
Madam President, I want to speak a little bit in detail on another projection or another direction we have on the student loan crisis, I guess. And it's a shame that we've come to this. A year ago, I voted for the extension. We were told at that time that because of the political atmosphere we had in the election of the president, big election year coming up, that we really couldn't get into the details and fix it the way it maybe needs to be fixed and should have been fixed back then. So a lot of us went ahead and voted for the extension, and we find ourselves in the same position this year as we were last year, and there will be another election in 2014. So it seems like that we're always in an election cycle, and if we allow that to continue to direct what we do and how we do it, then we get very little done here, which is what I think the public's getting frustrated with. So a few of us got together, myself, and we got with Senator Alexander, we got with Senator Carper, Senator King, and decided that maybe we could come together and work on something. There's no perfect fixes for anything here that I found. And this is such a complicated and it's very confusing to a lot of people if you don't delve into it. And so I started looking into it more this year than I had before. I think a lot of our colleagues and a lot of people in the country believe that the so-called doubling of the rates that went from 3.4 to 6.8, that everybody's rates had doubled. First of all, there were just a few or small percentage of the loans that we loan out were even getting advantage at 3.4 that we extended. 75% of the loans, 75% of the money out there is at the higher rate of 6.8 or above. And I tried to understand the best that I could all different aspects of the loans we have out there. We have the subsidized loans. Because of family income and participation, you're able to get a subsidized loan. What that really means, and I think if you break it down, the first year that you qualify for a subsidized loan, you can borrow up to $3,500. Now, $3,500 in today's higher education world doesn't go very far. You're also allowed to borrow $2,000 of unsubsidized. That means you would have been paying 3.4% on the $3,500, 6.8% on the unsubsidized. So as you can see, it's not all clear-cut. So then on the second year, you can borrow $4,500 subsidized and $2,000 unsubsidized. It goes to $5,500, and it stays at $5,500 your fourth year. The thing that happens is the unsubsidized loans, if you're looking at unsubsidized loans, at 6.8%, they're staying. Now, we've had some say it's better to leave it alone, do nothing, let it go ahead and double at 6.8 and leave it where it is. We've worked out, and along the lines of the President put in a proposal. Also, we had the so-called House Republican proposal. Our proposal is much different. This is not a Republican piece of legislation or a Democrat. It's a bipartisan piece that we've looked at all aspects of what we have to deal with in today's market. July 1st is when the rates went up. If we're able to come to agreement this week or maybe the first of next week, we can retroactively bring those back. So when you go to school this fall, you'll know exactly what your rates are being. We've come to where we've had a bipartisan agreement that those rates could be 3.66%, and that's for all undergraduates. So if you're getting a subsidized loan and you're getting a unsubsidized loan, you would have, if the one-year extension goes, it's 3.4 and 6/8. Under our proposal, everything's at 3.66. 3.66. That'll save about $9 billion this year in interest that you would be responsible for paying. $9 billion for the youth of this country trying to get higher education. If we just do the one-year extension, which my colleagues on my side of the aisle, the Democrat side of the aisle, that's only a savings of $2 billion. There's a $7 billion savings up and beyond what the one-year extension would do. We're just dealing with the facts we have in front of us here. So we keep looking at all the different things, and people are talking about that. Let's say that you're going to a graduate unsubsidized Stafford loan, a graduate unsubsidized Stafford loan, which many people get in graduate school. Right now, a graduate is 6.8%. Under our proposal, that goes to 5.21%. If you have the PLUS loan, that's parents and graduate students, that loan today you're paying 7.9%, and you've been paying 7.9%. Our bill takes that to 6.21%. And as you can see the savings there, someone says, well, the interest rates will go up after 3 or 4 years, and then you'll be at a higher rate. We put also the same as in the law right now, 8.25% cap. So at any time, if your rates, so when you lock this rate in, you borrow money this year at 3.66%, that's locked in for the life of the loan. That's what you pay for the money you borrowed this year for the life of that loan until you pay it back. Next year, it could be 4.5. It could go up. You could have inflation when I was in school, and then later on, inflation kicked up 16, 17%. Outrageous. What we've been able to come to agreement with in this body, in the Senate, Republicans and Democrats, have come to an agreement that we don't think at all the policy of this country should be that we should make a profit on the loans that students are receiving to educate themselves, to have a better quality of life and opportunity. We've come to that agreement. That's not the bill we got from the House. They wanted to use profits to pay down debt. Now, I understand there's a lot more that needs to be done on the profit end of it and how we get to the true profit, the true cost. And, Madam President, you've been working hard on that, and I'm willing to work with you very hard on that. But what we have in front of us today, we've come to that agreement that we are not going to make any profit that will go to debt reduction. The profit, basically, if there's a so-called profit, it should go to reduce the rates to give you the lowest rate that we possibly can offer. And that's what we've agreed on. We've agreed on fixing the rates for the life of the loan. That's not what came from the House. We agreed to do that. So when I say it's a bipartisan bill, these are things that we're agreeing on that makes a better piece of legislation that we have. There's people saying, yeah, but 4 years from now it might go up higher than that, than 6.8. Well, let me say that 3 to 4 years that we know that we're going to have tremendous savings, there's a difference. There's a difference of $36 billion versus maybe $8 billion if you just keep extending 1 year at a time. $2 billion savings here, $9 billion savings here. 4 nines is 36, 4 twos is 8. It's not hard to do the math here. And they talk about a comprehensive education bill. I pray to God that we can get a comprehensive education bill. But I'm not sure that the American public believes that we're able to get any type of a consensus on any comprehensive bill. We haven't as of yet. I've been here. When I first got here, they told me that, you know, we're trying to get our house in order, financial house. And then we had the sequestering coming at us. And the sequester basically was a penalty that we voted on because no one would ever think that we would let it get that draconian to the point where we couldn't come to an agreement and we'd have to have this type of a punishment put on ourselves. We thought that would happen. So we put a super committee together. The super committee was put together for a purpose of basically getting a super deal that we could get our financial house in order. It wasn't that super. It didn't work. So then the sequester kicks in. And the draconian cuts across the board. You don't run your life that way. You don't run your businesses that way, whether they're small or large. You don't cut everything. You have basically your priorities and necessities that you have to maintain in your life on a daily basis. You have excesses you can do without. So you kind of make adjustments, and you pick and choose. That's not working right now. And what's happening is that people are suffering needlessly because we cannot come to an agreement to get our financial house, to find a budget that works for this country, to find a tax system that's fair and equitable that people believe in. We haven't been able to do that. But we're being told, let's go ahead and extend the 3.4% for the smallest portion of the amount of loans that we loan out, and everyone else pay the higher rate. I'm not willing to do that. I think we can do better. I think we are better than that on both sides of the aisle. And chastising each other and saying one's wants to raise rates and one's insensitive towards students and it's a Republican or Democrat plan doesn't fix anything around here. It hasn't since I've been here, and I don't think it's going to. It will if we put our country first. And we know one thing, by putting our country first, we put our students first. Without an educated populace, we have nothing. We can't compete in the world of economics. We can't compete in the world of science and technology. We just can't. So the best investment that we can make is in our youth. The best investment you can make. The best investment you can make is in education. You might buy a car and think, oh, that's a great investment. You might buy a piece of property, that's a great investment, or a house. The best investment you'll ever make is in your education. We want to make it as affordable and doable as humanly possible. And that's what we've worked together. We've worked together with myself and my colleagues on a bipartisan basis. We're hoping that we can find. And if we can find common ground, and if it basically is putting a cap, and we've talked about a cap, the caps are inherently built in. Let's say this. Let's say that you graduate and get a degree, but you find a job that pays $40,000, which is not a lot in today's market for the money you've invested. And you get married and have a child or two. The system we have built in right now, you only pay 15% of your disposable income. That breaks down to about $142 a month that you will pay on your student loan to make it affordable. And if you're unable to pay that off, at the end of 25 years, it's exonerated and wiped out. Pell Grants, you know, I don't need to tell you about a Pell Grant. If a person's in need because of their income, they can get up to $5,645 a year free. Those are grants that we give out, Pell Grants, which are excellent, helping students that just don't have an opportunity or chance with any support from their family to be able to go to higher education. We do that. And we're doing an awful lot of things that we do to help. But the bottom line is we've come to an agreement that it shouldn't be subsidized and there shouldn't be a profit made, and it should be affordable, and it has to be run efficiently. So I would hope that people would look. I think the $36 billion of savings over 4 years is pretty substantial compared to us doing nothing. And saying to leave the rates, let them go at 6.8, it's better off, I think they're misinformed. I don't think that they've been told the facts or the truth. So what we're asking for is basically a level playing field, looking at what we can do, something positive, getting more groups to sit down sincerely and working towards what I think is going to be a good outcome, a good process here. extending what we have doesn't work. Not being able to come together to make sure that our loans are affordable is not acceptable. And I think if we continue to strive to work towards finding a reasonable outcome, that we will be able to succeed. So with that, I said that tomorrow we will have a vote on this, and there'll be more discussions about student loans. The bottom line is that we want rates to come down for everybody. Every student in every category should have the benefit of a lower rate with the lower rates that are available to the public today. So with that, Madam President, I yield the floor.